Welcome to our channel. This is Ashish, and in this video I will be discussing about the external nose. So from the previous video we know that the nose is divided into two, that is the external nose and the nasal cavity, from the easy way of understanding. So for the easy way of understanding or for the descriptive purposes, the nose is divided into two, the external nose and the nasal cavity. So we will have a look on the external nose first, then in the next video we will discuss about the nasal cavity. So if you are new to our channel and have not subscribed our channel yet, please click on the subscribe button below and do subscribe our channel. So let's have a look on the model and then proceed further with your theory. So let's have a look on the model. So this we'll discussing about the next video. So this is the so-called nose, that is a pyramidal projection on your face. How? See, if you look at the cross section, the shape is that out of a pyramid. That's why when we say the external nose is nothing but a pyramidal projection on your mid face. Mid face means the forehead, then mid face, then near the oral region. So it is the projection on the mid face. Suppose the plane of the paper is the plane of your face and the nose is present actually on your face like this. This is the root or the bridge, and this is the tip of the nose. So this portion, this fixed portion on the upper part is nothing but the root or the bridge, and this free part is called the tip. So we have the superior, suppose because the nose is present on your face vertically, so this is the more superior portion and this is present little inferiorly, that is the tip is present little inferiorly. So this is the nasal cavity. The space you can see in between the bounded by these boundaries, that is the external nose, is called the nasal cavity, the space in between. So next video is about the features of this space, and in this video we'll discuss about the what this external boundary is made up of, that is the what are the bony parts and what are the cartilaginous part. This portion as I told you is the tip, and this is the root of bridge, and this vertical ridge you can see on your nose, this vertical ridge is nothing but the dorsum. So I have removed the nasal septum. So if I put the nasal septum back, so as you can see all these elements, because I made audit of the periodic table, so don't get confused the chemistry, we are learning anatomy. So this is the nothing, this is not the periodic table, this is the nasal septum. So this is your nasal septum, and let's insert it on the nose. So you can see the nasal septum divided the whole nasal cavity into two, left and the right nasal cavities. So we'll have a look on what this nasal septum is made up of and what this lateral wall is actually made up of in the next video, and that are the most important topics from the nose part. So if you look on the external features, as you can see, this red portion denotes the bony part, and the other portion below is made up of cartilaginous part. So bony part is present more superiorly near the root or the bridge, and the rest of the portion is made up of the cartilaginous part. Now let us look at the features of the nose and see how it is present on the face. With the pyramidal projection, that is the nose. So we have the features, that is the tip of the nose, root or bridge, the dorsum, nostril, and the ala. The mobile lower portion that you move like this is nothing but the tip. So the mobile lower portion is the tip, and this fixed upper narrow part, this narrow portion, see here this is broad and upper part it is very narrow. So the narrow upper part that is fixed is called the fixed narrow upper portion, is the nothing but the root or bridge, and the vertical ridge that you see in the mid portion. So the vertical ridge that we see on the mid portion, this is the nothing but the dorsum. So this is the ridge separating two lateral portions, that is the two lateral sides, separating two lateral sides, and extend from the root to the tip. So it dorsum extend from the root portion till and extend up to the tip, from root to tip. And what are these nostrils? So the space from which the air enters your nasal cavity, these spaces, the two spaces that you see are nothing but the nostrils. So the nostrils are the open portion. So these are the open portion through which air enters. Through which air enters the nose. And what are this ala? So ala, if you are in the younger age, in the art book, if you asked to draw a nose from the lateral side, you used to draw like this. It's true or not? You have to draw the nose like this. So the curved portion on the lateral sides that you make, the curved portion on the lateral sides are called the ala. So I hope it's very clear. If you make nose from the lateral side, you always draw like this. So this curved portion on the lateral sides are the ala. Now what is this wall is actually made up of some bony part and some cartilaginous part, and we have to discuss that. So the upper portion is, I told you, as bony, and rest of the portion is the cartilaginous part. So the skeleton of the external nose is partly bony and partly cartilaginous. So the bony portion are two bones. We have two bones in the bony part. So we have two bones and the 5 major cartilages. Why I say major? Because we have number of minor cartilages as well. So let us have a look on the model how these cartilages are present. So in the uppermost portion, we are looking from the lateral side. This is the root or the bridge, and this is the tip. This near the root portion, what you see here is the nasal bone. The two nasal bone meet in the center and forms the beginning of the dorsum. Apart from this, we have some more structures forming the bony part, that is the frontal process of the maxilla. As you know, maxilla present on the sides, it gives a contribution to the upper narrow portion and act as a bony portion for the skeleton of the external nose. So in the bony portion, we have two bones, that is the two nasal bone meeting in the center and the frontal process of the maxilla. And what about the cartilaginous portion? This orange portion that you are able to see on the both sides, the orange portion is a cartilage that is called the lateral cartilage. So we have in total 5 cartilages. These are the 2 lateral cartilages, and this shape structure, horseshoe shape structure that you are able to see, this blue color, is nothing but the major alar cartilage. Okay, I hope it's very clear. We have 2 lateral cartilage and 2 major alar cartilage. So out of 5, we have discussed the 4, 2 lateral and the 2 major alar. And apart from this, we have one more structure, the nasal septum. This portion, the nasal septum, is actually made up of some bony portion and some cartilaginous portion, and that contribution is made up by the septal cartilage. So we have some septal cartilage as well that forms a skeleton of the external nose. So if septal cartilage is present in the center portion, so you not able to see in this model because it's present more anterior in the deeper portion. So we have to go to all the names of the skeleton portion. We have 2 bony parts, that is the 2 nasal bone and the frontal process of maxilla. We have 2 cartilaginous portion, the 5 cartilaginous portion, the 2 lateral cartilage, the 2 orange color lateral cartilage, upper part the red color, the 2 nasal bone, 2 orange colored, that is the 2 lateral cartilages, the blue colored shape, that is the 2 horseshoe shape major alar cartilage, and a septal cartilage in between. So you can see a question mark over here, the 2 major alar cartilage, we have a question mark. So because you have to know more in depth about this. As you can see in the diagram or this model, the alar cartilage is actually horseshoe shape. See, it's very clear. It is made up of 2 horns. That is why it is 2 horseshoe shape structure. So first point that you know in the major alar cartilage, it is horseshoe shape. Apart from this, one more thing I have to tell you. It is made up of 2 cruras. How? See, you can see it is present on the lateral side. It's very clear. Present on the 2 are present on the lateral side. So it is present like this. So it is present on the both sides like this. So it is horseshoe shape. You can clearly see it. I am making U. So it is made up of two crust. This is called the, because it is more lateral, it is called the lateral crust. This is also lateral crust, and the middle portion is called the medial crust. Medial crust, same, it's both are the same thing. So from the right and left side we have the two medial crusts. They approach in the center portion. So this center portion made by forming of the two medial crust is called the columella. Columella I will discuss in detail when I have discussed the nasal septum. It will be more clear. So by the time you remember, the major alar cartilage is horseshoe shape and is made up of two crusts. See, when you make U, we have two, this portion, pointing portion. So in the case of the nose, one is called the lateral crust and one is called the medial crust, because we have a pair. So the center that is facing towards center is called the lateral crust. Sorry, the facing towards the center is called the medial crust, and the towards the outward is called the lateral crust. So by the time you should remember this portion. Now we have come to the end, but let me tell you one more thing. I told you we have 5 main cartilage and a number of minor cartilage. See in this diagram, this orange portion, that below the orange portion, these green dots that you are able to see, these are nothing but a number of small tiny particle the cartilage that is present. So these are not given the category of a main cartilage because they are very tiny and are present in numerous quantities, and their number vary from person to person. So in addition to all these 5 cartilage, we have other tiny cartilage, the green portion, that is present more anteriorly, more superiorly to the major alar cartilage, and is surrounded by this fat portion. The yellow portion that you see here on both the side is the fat and is present in the fatty portion. These are called the minor alar cartilage. So like this we have come to the end of the external nose, and in the next upcoming videos we'll be discussing about the lateral wall and the medial wall, and how to differentiate in a diagram where what is the lateral wall and what is the medial wall. That all we will see. So till then, keep sharing and have a good day.